Hello, I'm Michelle Anderson and I am a birth educator and birth coach, and I've been really looking forward to this video because what we're going to talk about today is a concern that I have seen come up time and time again with many of the mothers that I work with, and I would say it is probably the number one fear that most mothers experience, and that is tearing during birth. So in this video today, we're going to talk about 4 specific tips and proven techniques that can help you to reduce tearing and specifically to reduce having a severe tear. The first and most important one is perineal massage. This should be done starting at around 34 weeks during pregnancy, and it's recommended that you do this anywhere from 3 times a week to every single day. And when you perform these massages, you should be doing them from about 4 to 5 minutes each day. The benefits of perineal massage is that it increases elasticity and toning of the vaginal muscles and preps them for what they're going to need to go through as your baby is crowning. And the second thing is that as you practice doing perineal massage and practice breathing and relaxing through the discomfort of the massage, it's really helping you to prepare to stay calm and to breathe through that discomfort that you will experience as your baby is crowning. If you are to do any of these things that I suggest in this video, this is the number one and most important one. The second is to use a warm compress during the final phase of labor. So during what many people call the pushing phase, or in the hypnobirthing world we call it the breathing down phase. So this is as baby is beginning to descend and crown and leading to the birth of your baby. What a warm compress does, and by warm compress I mean using a very warm washcloth, and you apply it to the perineum as baby is crowning and as you are pushing baby out. The benefits of using a warm compress is that the warmth from the compress can help blood vessels to dilate and help with blood flow. It can also help to warm up the perineum tissue, helping them to become more stretchy and flexible, which you definitely will want. Third is your birth position. So if you remember anything about birthing positions, it's to avoid birthing on your back. The 2 best positions to avoid and reduce chances of tearing is either side lying or being on your hands and knees. So this can help to create a gradual descent for baby rather than a completely upright position where gravity is pulling baby down, which can make it harder to have a more controlled birth, or being on your back where you are having to push a lot more to get baby out. The 4th and final tip is to control your breathing. So rather than what we call purple pushing, where you are holding your breath and you are pushing, basically it feels like you're pushing your guts out. Obviously, if you think about that, you want to avoid purple pushing or pushing with all your might, because that is going to take away the effect of baby's head gently massaging and stretching out the vaginal tissues, and it's just going to, from the strength of your pushing, you're just going to pop baby's head right out, which is going to most likely lead to some type of tear. So if you can control your pushing, doing small little pushes rather than big pushes, that can greatly reduce your chances of tearing. So that's the end of this video. If you want to learn more about pregnancy and birth and how to feel empowered through this beautiful journey, please follow me on Instagram, subscribe to my channel, or if you're interested in taking a birthing class, you can go to my website at empoweredbirthingutah.com.